big story we're focusing on is the Prime Minister's meeting with Chief Ministers. The video conference began at 3 o'clock this afternoon. It is still going on. It is because every Chief Minister is speaking and giving his or her point of view. My colleague Sanket joining us now with the very latest from this. So Sanket, what's the broad trend that's emerging, and important message also from the Prime Minister, which seems to suggest a shift in the centre's position at least?
Absolutely. And many people would say that perhaps the Prime Minister is talking more about easing of restrictions than actually imposed restrictions. And many states actually saying that they want the extension to continue. So it's interesting. And as Nidhi mentioned, that this is a very, very significant meeting between the Prime Minister and the Chief Minister, simply because no other meeting has lasted this long. This is the longest meeting, the 5th meeting that is taking place. So it's a marathon video conference where the Prime Minister says, we'll tell you what the PM has said. He says that globally, India's efforts and measures have been recognized. So that point he has been making continuously, he makes that again. Slowly, economic activities has begun. The stress that Nidhi was talking about, the economic activities have begun. Then he says, prevent the virus from spreading to rural India. Now, this was the biggest challenge, because of which migrant movement was not allowed, but he had to give in. He says, I appreciate the efforts by the states that in fact have been made. The chief ministers are also speaking, might have to change a few decisions. Now, why does he say this? He said this in the reference of having allowed these trains and buses to operate for the rural migrants to actually go back to their homes. He didn't want this to happen, but he had to give in to the people's opinion. He says, give suggestions on economic matters. So he wants more cooperations between the state as well as the centre. The states have been asking for a relief package because they felt that this lockdown was imposed on them. So lots of important points that the Prime Minister has made, apart from Nidhi, very categorically mentioning that you have to maintain do gaz ki duri.
Right, so that's the message from the Prime Minister. But what have the Chief Ministers said? And it's interesting because we know that at least 4 of them, that's Mamata Banerjee, Uddhav Thackeray, KCR, the Telangana Chief Minister, and one more, that's the Punjab Chief Minister, Amrinder Singh. They've all talked about a lockdown extension, while some others like Jagan Mohan Reddy and Arvind Kejriwal have spoken very differently. Let me first take this question to Sukirti, who's joining us from here in Delhi. And Sukirti, in Delhi, Chief Minister Kejriwal suggesting that the national capital actually be largely opened up now.
Well, yes, the reason for that is said to be that Delhi currently has 81 containment zones, which comprises only 3% of the population and 1% of the total geographical area of the city. But it is all 11 districts of Delhi which are suffering from all the lockdown measures. And that is why Arvind Kejriwal has been pushing forward that all of these red zones should be marked ward-wise. Only those specific areas or streets which have cases should be marked as red zones, and rest of the city should not continue to face economic as well as job losses. So while cases in Delhi have been increasing, new cases coming.
We're just getting a news flash that Chief Minister's meeting with the Prime Minister has just ended. It has just ended. We will probably get a press release from the Prime Minister's office shortly on closing remarks made by Mr. Modi after talking to all the Chief Ministers. But let's just go across to Sam Daniel, also joining us from Chennai. And Sam, the Tamil Nadu Chief Minister, we hear, made an appeal to not start planes and trains until the end of the month.
That's right, Nidhi, because the numbers keep rising both at the state level, particularly in Chennai as well. Today it touched 8,002 across Tamil Nadu, and Chennai alone accounting for around 600. Totally 798 new cases, and the state government is very clear that allowing flights to land and train service to resume before 31st of May could actually worsen the situation. He in fact tells the Prime Minister that the state is witnessing, particularly Chennai, an increasing trend, and that's why he wants these to be put on hold at least till the 31st of May, but we don't know what will happen. But otherwise, he has also made 2 crucial demands: a 2,000 crore aid immediately to be able to help the state buy medical equipment, and also for industries to help the MSMEs. He wants 1.25 lakh crore allotted for Tamil Nadu as a credit allotment for entrepreneurs here.
Let me just go across to Saurabh Gupta in Mumbai. And Saurabh, Uddhav Thackeray making the point that the lockdown should be extended for longer. I guess given Maharashtra's and Mumbai situation, that's not a surprise. But he's also made an appeal for local trains to resume, at least for essential workers.
Absolutely, local trains are the lifeline of Mumbai, and right now essential workers, for them getting to their workplaces is a challenge. But Nidhi, let me just share the figures that have just come in right now. 1,230 new cases in the state today, taking the tally up to 23,000. Now Maharashtra has crossed the 23,000 mark. 587 patients have been discharged, so the number of discharged patients is 4,786, and Mumbai now is at 14,521 cases with 528 deaths. But yes, the Maharashtra Chief Minister making it very clear that both have to go hand in hand. While containment lockdown has to continue, services have to resume, economy has to kickstart, and that's something that he focused on. Also asking for Maharashtra's share of the GST that's pending to deal with the economic crisis that the state faces.
Right. Monideepa Banerjee from Kolkata. And Monideepa, quite an explosive conversation, not surprisingly, between Mamta Banerjee and the Prime Minister today. What happened?
That's right. Mamta Banerjee confirming to us that yes, indeed, she expressed her grievances with the Prime Minister at the meeting, and what she was probably most outraged about, and I'm quoting her over here, she said that why is it that they are going Bengal, Bengal, Bengal and constantly criticizing the state when the state is actually cooperating with the center on every count. She said that Bengal is, needs help, but not the criticism that is coming her way. She is upset with the politicalization of the situation, and she is also upset that there is no consultation, and that the decision is taken by the center and then the states are expected to follow suit, toe the line. These were issues that she spoke out about in the meeting.
All right, and finally, Uma Sudhir with us from Hyderabad. And Uma, Jagan Mohan Reddy of Andhra Pradesh and KCR of Telangana taking very different positions on what the next steps should be.
Yes, indeed. Even otherwise, even on testing, I would say they have taken very different positions, because while Telangana has hardly done about 20,000 tests so far, Andhra Pradesh is much ahead. They are in fact the highest in the number of tests that they have done per million of population. And yes, while Jagan Mohan Reddy is talking about reviving the economy and normalcy as soon as possible so that the economy can be revived, Mr. K. Chandrasekhar Rao has also requested that in fact the trains should not be run for the time being, because he is pointing out that all the metros, in fact, are the places where you have the highest numbers, and if trains are also going to run, you're not going to have be able to test them nor put people under quarantine, and that's going to only increase the problem. The second, one common thing both of them obviously, or rather all states would ask for, is for the FRBM limits to be increased, and that loans should be either waived off or staggered, and states are not in position to repay the loans. Andhra Pradesh in fact said 16,000 crore rupees should be given for improving the medical infrastructure. Right. But KCR also asking for those zones. In fact, with the low testing also, maybe that is the reason you have about 22 of the 33 districts not having any positive case for the last 14 days, and KCR wants them to be declared as to be promoted to either green zone or orange zone, and he says that process is not happening very quickly. So that's something that he's worried about.
Right. All right, Uma, I have to leave it there. Thanks very much for joining us. All the bureaus there giving us a sense, a summary of what the chief ministers have asked for. So is there a plan? Do we have a clearer idea of where we're going to go after the 17th of May or perhaps before that? Sushmita Dev, national spokesperson of the Congress, is with us. Shaina NC of the BJP. We'll also be joined by Mihir Sharma, senior fellow of the Observer Research Foundation, in just a moment. But Sushmita Dev, to you first. The meeting with the chief ministers has just ended. I suppose that even though you're in opposition, would you say that at least this exercise of talking to chief ministers, consulting them, that itself has been one of the better things that has emerged from this crisis? The centre at least talking to states and working together.
You see, Nidhi, I think it's the fifth such interaction. It's not the first time the Prime Minister has done it. And as an opposition party, we hope like hell that these interactions must lead to follow-up action. I mean, there's no other way to proceed. Interaction is very good. We welcome it. We thank the Prime Minister. But it's not just about listening to the chief ministers, but it's working with them, trying to do some hand-holding without any arm twisting, facilitating what the chief ministers need, on a war footing. Because the reality is, if anybody is going to fight COVID, it will be the chief minister and their entire machinery that works at the state level. And we are hoping that unlike the last 5 interactions, after these interactions, the stimulus will kick in. Hopefully, the entire migrant worker movement across the country is a big challenge for the bureaucracy at the state level, that the central government with help will need the help of the central government for testing kits, PPE kits,
Right.
all of
but
that.
there's another important point which a
a
lot of states made today. I'll take that to Shaina, and that's that point that many chief ministers made, Shaina NC, was that let states now decide how to classify districts into red zones, green zones, orange, etc. Let states take a call on what they want to allow, what they don't want to allow. Let there not be this kind of micromanagement from the center and from the Home Ministry. Would you say that that is a model that needs to be followed now?
Well, Nidhi, at this point, all I can say is that yes, we unitedly are in this fight against COVID. But if my opening statement says, if you take my home state of Maharashtra, where in a city like Mumbai, you have 20% of the cases, 60% come from our state, it's a very, very scary scenario. Having said that, I'm glad that the center and the state are coordinating, but if there is an administrative collapse, which we are seeing, we heard of the Sion hospital story where you had dead bodies in the COVID ward with COVID patients on the next bed. We had a similar case today in KEM hospital. So I think the coordination has to be very, very tight. And this is not a time about, which state belongs to which party. It is about the better interest of all, which is that to ensure we have tracing, testing and treatment in that order, which doesn't seem to be this case in quite a few states. Having said that, I'd like to applaud a state like Orissa for, creating this kind of an infrastructure. The Prime Minister himself said Rajasthan has done a very good job and complimented Ashok Gehlot in the Chief Minister's meet. Having said that, in a state like Maharashtra, I really fail to think what is going to happen with Mr. Uddhav Thackeray's suggestion of local trains functioning. I do concede they are the lifeline, but look at our state. You had Palghar where 500 people were out, 2 saints killed. You had incidents, and this is not about trying to selectively pick, but this is about the harsh reality that we have not been able to have serious social distancing as we would have liked. And when the lockdown does open, these are serious questions that
But
need
the question
to be
is,
answered.
the question, Mihir Sharma, is that the lockdown eventually has to be opened. And a question that I'm asking today is that even after almost 2 months, the whole point of the lockdown, Mihir, do you think the problem was with the messaging in the beginning? The messaging that came right from the top, actually, from the Prime Minister, that we're going to win this war over Corona in these, the initial lockdown of 21 days. And I think a lot of people got this impression somehow that this virus was going to be finished in that 21-day period and then a 40-day period subsequently. That's not going to be the case. Every doctor you speak to always says that this lockdown was meant to buy us time to pad up our infrastructure, make sure our hospitals can cope with rising infections. So is there a problem with how we set out our goals with regard to this, and therefore are finding it a little difficult to find a way to come out of it?
I think that in some sense, I don't think the Prime Minister said that this would be done and over with either in the first or second or third lockdown. But there was, I think, a belief that if, given the way that communication happened, that all we needed was a period of lockdown and then things would go back to relatively normal. At no point did the Prime Minister say that this problem will persist. He did not say it would not persist either, unlike some other world leaders. But it is true that I think telling people that they're in for a long haul, a long fight against the spread of this pandemic is something that we should have started doing earlier.
Right. So, but Mihir, what do you think the roadmap could be from here on? For instance, the suggestion that, say, Arvind Kejriwal or Jagan Mohan Reddy have given today, which is you need to get life back to normal, but you need to have precautions in place. You have to have new SOPs in place about how we travel, how we work, etc.
Well, yes, I think we have to try and learn from the countries that have moved further along the curve than we have. Most of them, when they are reopening, have a very, very close, in some cases intrusive, form of, internal passports. In China, for example, their equivalence of the Arogya Setu app, you have to show, you have a green status on them the moment you enter any kind of crowded space, even malls and so on and so forth. In other parts of the world, even though there has been reopening, places like shopping malls are still shut and may be shut for the foreseeable future. So whatever kind of reopening we have, at the most, I think we're not going to get back to pre-pandemic normal for many months.
That's right, but we have to figure out what the new normal is. And one of the important things, Sushmita Dev, that I thought the Andhra Chief Minister said today was, and which was constructive, was you need to remove the stigma around COVID. I think there is a complete panic and a fear that has set into the minds of people, forgetting that most people who do get coronavirus also survive. They are okay. 98% of people, as doctors say. So is there a problem again that is it the responsibility of political leaders, chief ministers, the prime minister to kind of drive home that point that we need to be very, very careful, but let's not panic, let's not stigmatize people and sort of deal with this entire problem with the danda all the time?
Definitely, there's a psychological war that also has to be won, with the COVID-19. It's like people are not sure whether it's safe to get out, even if the lockdown has been eased out in Delhi, but we don't see that many people on the streets. Then if you are also worried about the ICMR consistently saying that the number of asymptomatic people are really high, and then we've had incidents of people, misbehaving with doctors and nurses who are going for testing. So I think everybody, whatever position they hold, and even in other walks of life, whether it's some celebrity or chief minister or prime minister, we have to speak in one voice to say that, look, the way out of this is not to stigmatize somebody who has COVID. We just have to treat that person. It has to be done systematically, and everybody has to help. Because if you stigmatize Nidhi, then nobody will come forward to say, I have the symptoms, because they are scared of how people are going to react. So we have to stand together in the messaging that the way to fight it is to volunteer and say, I think I may have it. Can I be tested?
But there's a political...
So stigma has to be fought.
There is a political question here as well. And I want to ask Mihir that question before I take that to Shaina. That Mihir, the lockdown when it began was a very top-down approach led by the centre, led by the Prime Minister. It was a direction to the rest of the country that, boss, this is happening. You all have to follow it. Is the exit now, the onus being put on the states, and politically, is that being done very consciously? Because exiting a lockdown like this is far trickier. Imposing it is easier. So do you see a subtle political shift as well in how this is being handled?
Well, absolutely. I think that political shift was in fact visible even when the time came to start extending lockdowns, right? When the third phase of the lockdown came, there was no accompanying hoo-ha or, prime ministerial speech with making that kind of point. I think there is no positive outcome for any politician from a decision to extend the lockdown or, in fact, to reduce it. Because if you reduce it, that means, and if you say I'm going out of it, then as and when the epidemic returns, you will be blamed for leaving early. If you extend the period of the lockdown, you will be blamed for keeping people at home and for depressing economic performance, and for, in some cases, keeping people close to starvation. So any smart politician, I think, would have done what the Prime Minister did, which was, I'll shove off this decision onto the chief ministers and keep myself above the fray. And that's exactly what he's done.
Shaina, do you want to respond to that? So sort of putting the onus now on states deliberately?
No, I don't think that's the case. I think it's about coordination between the states and the centre. And the Prime Minister made two pertinent points today. One is he said that economic activity must start even if it's in a restrained manner. And for that, he gave he left the prerogative to the state chief ministers, because obviously they are the ones who know which are the containment zones and which are not, and which are the areas which can be opened out without getting into a backlash. And the second important point which he made, which we must take very seriously, is that this pandemic should not spread to rural India. Given the vastness of the size of our country and the population, we need to work collectively with the administration, the center and the states. So I don't think this is passing the buck. This is, if at all, coordinating to the best of our ability. And if this is seen as some kind of one-upmanship game, we lose the battle and the war with the invisible terrorists. So I think that it's high time we really speak above party lines, we really coordinate and understand that the goal is only to save humanity and to save every concerned citizen who is tested positive, every COVID citizen who is tested positive, by ensuring that they are not in panic mode and they realize that we can tide over this and this time shall pass too.
Well, at what cost is the question? And so, Mihir Sharma, I want to ask you that if India works in silos where some states open up, others don't, and given our very complex supply chains and the way our economy is structured, are we going to be able to withstand this economically?
The longer that supply chains don't function, the more companies and small and medium companies included will be pushed towards bankruptcy, and the worse our employment performance, job prospects, and so on will be going forward. I think that's absolutely true. That said, it is entirely possible to have a patchwork reopening as long as supply chains are intelligently maintained. Many other countries, for example, you've created very effective e-passes on phones that are shared between individuals, and particularly those in the logistics industry. But you have to ensure that there is some central coordination about this. So let us say a factory in state A which does not produce essential commodities itself, but which provides inputs to a factory in state B that does produce essential commodities. Let's say if the first factory is shut by its local state administration, then that's as bad as shutting the factory in the other state as well. So you do need coordination over national supply chains, which state chief ministers will not be able to do. And the central government will have to make recommendations about who gets what kind of curfew passes. And I hope there is some kind of ability to create those recommendations in the center, at the center. Currently, I haven't seen any signs that they're setting it up.
All right. Thanks very much to all of you for joining us tonight. We'll be bringing you updates on the end of this meeting between the Prime Minister and Chief Ministers, possibly another address by the Prime Minister in a few days before the lockdown ends. Let's see what happens over the next few days. Thanks for joining us. Good night.